Hey guys, this is Soumitra, and you are watching my YouTube channel Medico Soumitra. So today I'm here with another video of schizophrenia, that is part 2. So in previous videos of schizophrenia, I have discussed about the clinical types and what is schizophrenia and all. So today I'll discuss detail about the different clinical types of schizophrenia, like paranoid schizophrenia, catatonic schizophrenia, and heavy phrenic schizophrenia. So we'll see one by one. Okay. So first we'll see the paranoid schizophrenia. The word paranoid schizophrenia means delusional paranoid schizophrenia. Is at present the most common form of schizophrenia. So what is the meaning of the paranoid schizophrenia is delusional paranoid schizophrenia. So it is also called as delusional paranoid schizophrenia. There are certain types of paranoid schizophrenia, including delusional persecution, delusional preference, delusional jealousy, delusional grandiosity, hallucinatory voices. So I picked some of the important types of paranoid schizophrenia. So we'll see one by one. So delusional persecution. Delusional persecution, in persecutory delusion, individual believes that they are being malevolently treated in some way. So the perfect example for the delusional persecution is the suspiciousness. Like the individual who is suffering with the schizophrenia, no? So they have suspects towards some people's, like some people's are planning to kill him, or some people's are planning, or they are doing some conspiracy to kill him. Like that example will be perfect for this delusional persecution. So always they are preferring like suspiciousness. Okay. Then we'll see the delusional reference, that the individual may falsely believe that others are talking about them. So it's a delusion of an individual. Okay, they will continue think like some peoples are talking about him always, even though the matter is not like that, even though like the thing is not there truly, but they are having delusions, they having the false belief that some peoples are talking about them. That is the delusional reference. Then we'll see the delusional jealousy. The content of jealous centers around the theme that the person's sexual partner is unfaithful to him. So it's a delusion of a jealousy where the individual will think like their partner are unfaithful to them. Okay. Then delusional grandiosity. They may believe that they have a special relationship with a famous person. Grandiose delusion of a religious nature may lead to assumptions of the identity of a great religious leader. So uh, grandiosity is a kind of schizophrenic condition where the individual or the mentally ill will think they are having a good relation of like um, a famous person. So you can take an example like the delusion grandiosity patient. They can talk with God, they will say they are talking with God, or like they are the king of a kingdom, they can say like that. Okay, that is the delusional grandiosity. Then hallucinatory voices that threaten or comment the patient, or auditory hallucinations without verbal form, such as whistling, humming, and laughing. So, in this paranoid schizophrenia, hallucinatory voices they can listen. Like they can listen some voices such as uh, humming and laughing and auditory hallucinations without verbal form. So these are the paranoid schizophrenia. Then next we'll see the heavy phrenic schizophrenia. The essential features include marked thought disorders, incoherence, severe loosening of the association, and extreme social impairment. So it's a special features in heavy phrenic schizophrenia, like thought disorder will be there, and incoherent, like they cannot relate the reality, they cannot relate the things with reality, like they cannot relate the time, person, okay, and area, they cannot relate, so they are incoherent. And severe loosening of association and extreme social impairment, so they are having lots of social impairment, they cannot they are socially impairment, they will be socially impaired, like very poor communication skill. Okay. And other oddities of behavior include senseless giggling, so unnecessary giggling, and mirror gazing, grimacing, mannerisms, and so on. So these are the characteristics of a heavy phrenic schizophrenic patient. And recovery classically never occurs, and it has one of the worst prognosis among all the subtypes. So it's a very poor prognosis among all the subtypes of the schizophrenia. This is all about the heavy phrenic schizophrenia. Next we'll see the catatonic schizophrenia. It's a very very important schizophrenia like paranoid schizophrenia. So it's a characterized by marked disturbances of motor behavior. This may take the form of catatonic excitement and catatonia alternating between excitement and stupor. Now we'll see the clinical features of the catatonia. So mutism, rigidity, negativism, stupor, echolalia, echopraxia, waxy flexibility. So these are the different sort of clinical features following in the catatonic schizophrenia. So we'll see what is the mutism meaning. Mutism mean absence of speech. So the individual will stop completely speaking. So absence of speech, mutism. Then rigidity, maintenance of the rigid posture against efforts to be moved. So it's a rigid posture, like they will follow a certain posture for a longer period of time. So maintenance of the rigid posture against efforts to be moved. This is the rigidity. Then negativism. Negativism is a motiveless resistance to all commands. So a motiveless comments, a motiveless resistance to all comments. So whatever the comments will be given to the patient, they will simply say no. So that is the negativism. Then we'll say stupor, does not react to his surroundings and appears to be unaware of them. So they does not react to the surroundings, like whatever is happening around him or her, they does not want to react. So this is the stupor. And that they appearing to unaware of them, so they will pretend they don't know anything. Okay. This is the stupor. Then echolalia I already discussed in terminologies, right? So echolalia is the sense repetition or mimicking of actions observed. So whatever they will see, they will try to repeat, and they will try to mimic of actions observed. Whatever they have seen, they will try to imitate through verbally, or through repeat, they will try to repeat it. Then echopraxia, repetition or mimicking actions which is observed. So it's a action, mimicking actions. They will do actions. Whatever the actions they have seen, they will do, they will implement in a action form. This is the echopraxia. Then waxy flexibility. So parts of body can be placed in a positions that will be maintained by long period. So it's just like rigidity. So they will rigid at a certain posture, but in waxy flexibility, the parts of the body can be placed in a positions that will be maintained by long periods of time. They can maintain the same body postures, or like body alignment of the different body parts for a long period of time. Okay, this is all about the clinical features of the catatonia. Then we'll see the residual schizophrenia and undifferentiated schizophrenia. So residual schizophrenia symptoms include emotional blunting, eccentric behavior, illogical thinking, and social withdrawal and loosening of the association. So symptoms include emotional blunting, so they cannot understand what they want to do. Okay, this is the emotional blunting. Eccentric behavior and illogical thinking, they cannot think properly, illogical thinking will be there. Social withdrawal, they will undergo to the depression, so social withdrawing can be seen. And loosening of the association, so they cannot associate, they cannot coordinate with surroundings, so loosening of the associations. This category should be used when there has been at least one episode of schizophrenia of the past, but without prominent psychotic symptoms at present. Okay, this is all about the residual schizophrenia. Then we'll see the undifferentiated schizophrenia. Undifferentiated, So by the name itself, we can understand undifferentiated. So the schizophrenia which is not differentiated properly, this category is diagnosed either when features of no subtypes are fully present. So this kind of schizophrenia definitely not exactly observable, or the causes for this undifferentiated schizophrenia is unknown. Okay, then we'll see the diagnosis, how you could diagnose the schizophrenia. A mental status examination, definitely we need to do a mental status examination. That mental status examination will reveal the truth, either the patient is suffering with the mentally uh, disorders or any other things. Okay, then psychiatric history obviously we need to do, because previous psychiatric history of your family members, they definitely can impact their mental stability or mental status. So previous psychiatric history definitely needed. And careful clinical observations, like clinical symptoms that I already discussed, like mutism and all, and delusional different sort of delusional behaviors. Okay, so careful clinical observation definitely it will help us to understand like the patient is suffering with schizophrenia or not. Okay, then the investigations include CT scanning, MRI shows enlarged ventricles and atrophy of the cerebellum. So if we'll do the CT scanning and MRI, that it could show like enlargement of the ventricles and atrophy of the cerebellum. Okay, so by that we can suspect like they are having certain sort of mental issues. Okay, then we'll see the treatment modalities. So there are pharmacotherapy, electroconvulsive therapy and psychological therapy. So in pharmacotherapy we'll see the clozapine 25 to 450 mg per day, that could be better choice. Then antidepressant, why? So we can see the social withdrawing, right? So social withdrawing helps to uh, leads to certain mental instability. So if we'll prefer the antidepressant, it will prevent. Then mood stabilizer we need to do, so controlling the mood. Then benzodiazepines. Okay, then we'll see the electroconvulsive therapy. Under electroconvulsive therapy, usually it is need to do 8 to 12 electroconvulsive therapy needed for schizophrenic patient. Then psychological therapy will do, that is group therapy and behavioral therapy and cognitive therapy and family therapy. So these are the certain therapies, like behavior therapy, behavior will be trained, and cognitive therapy like cognitive skills like learning, teaching and understanding, all those things, memory, all those things will teach in this cognitive therapy. And family therapy, they will teach how to coordinate with the family members and all. Okay, and group therapy, all the tasks will be given in a group, so that all patient they can understand, they can learn something. Okay, these are the treatment modalities. Okay, that's all about the topic of the schizophrenia. If you didn't understand, just pause the video and you can take the notes. And if there is any sort of queries, you can just do comment. And if you really like this video, just subscribe my channel, do likes, share with your friends. Thank you.